Is it a bug bite, a mole, a zit, or something more serious? Before you head down the internet image rabbit hole, we're going to help you get to the bottom of lumps and bumps. And join us is board-certified dermatologist Dr. Sonia Batra as we take on the big bump breakdown. And first up are these raised bumps that can sometimes be a little bit itchy. Dr. Batra.
So these are actually called dermatofibromas, and they're almost like keloid scars, but they go under the skin and actually tether it down. And they come up just from a minor injury, like a bug bite, or if someone nicks themselves shaving. Really common on the legs and really common in adults. But the good news is they're not dangerous at all. They just kind of come up and stay, and sometimes they can be a little itchy, but usually they are not even symptomatic. People are just aware that they're there because they see them. And you don't have to do anything for these as long as they remain stable. But as with anything, if something starts to grow or change or bleed, then it's always a good idea to have it checked.
And that's a rule with all these that we're covering. If you're not sure what something is, have a professional like Dr. Batra see you so that we can make sure that you are getting the correct treatment and diagnosis. But I want to move on to this next one. It looks like a mole, but sometimes they appear in clusters.
And these are one of the most common things people ever ask me about. They're called seborrheic keratoses.
Because they're very ugly.
And yeah, and people hate them because they look like warty brown and they're overgrowths of the skin.
Beauty is in the eye of the beholder.
I mean, they're mushroom kind of flaky, and they can be on the face and...
Occasionally, yeah, they can certainly occur anywhere. And these ones are almost like stuck on. They can have that little kind of verrucous or warty-like texture. But again, these are fortunately safe. If they bother someone, they can be frozen with dry ice. They can be scraped off.
You can even pick them off, I think, like literally yourself, which is, that's what makes them even grosser.
These off.
But the one thing is that even though they're totally safe, and even when we treat them, they often grow back. So they tend to be very stubborn. So just, as with anything, you know, if it seems to be coming back in a more aggressive way.
And you see they're oftentimes in the clusters we talked about. So the next one, and I've seen a few of these on my own body from time to time, and these are little bright red bumps. What are they?
So these are called cherry angiomas, and they're like little clusters of blood vessels or capillaries that come up, and they're bright red, like you said, and they look like little blisters almost, but they come up and they stay. And I euphemistically call these wisdom spots because they come up with time or age, and people often inherit them. Blood vessel issues like this can also come up in pregnancy, so it's really common for high estrogen states or when women are pregnant for them to get these as well. Again, totally safe.
Does it mean that you're wiser? Because I feel like once a week a new one pops up. I'm like, oh, there's another one.
Yeah.
Oh, there's another one.
No, they just come up kind of just because of genetics and time. And if you really dislike these, they can be lasered or cauterized to get rid of them, but you don't have to do anything.
So there is a hereditary component to it that runs in families?
So wise. All right, these little guys are up next. It almost looks like a permanent pimple, but feels more like a mole.
Yeah, and these are actually moles. They're called intradermal nevi. And what's happened is these are moles that when someone is very young even can start out just like flat brown regular moles. But with time, the pigment drops deeper down into the dermis, or the second layer of the skin. And so as the pigment drops down, the moles actually become raised up in these fleshy sort of pink or skin-colored spots.
Mole,
exactly, exactly. And so they do get sometimes larger with time. Usually if they're crisp, well demarcated and uniform like this, you just leave them alone. They're those clearer skin-colored moles. But as with any mole, if it's changing, like we said, have it evaluated. And to remove these, it's just like any mole. It actually has to be surgically excised.
The takeaway is if there's something going on with your skin, you're not sure what it is, get it checked out. And we can't thank you enough. Very, very helpful information.
Thank you.
Thank you.
We'll be right back.